know if your child's having social difficulties? Well, they may be uncomfortable in social situations. They may not want to go to parties that are already planned. There may be a lack of friends. They're unable to keep their friends. They don't follow the rules of the games. They're missing the social cues, the nonverbal cues, the facial expressions. They lack empathy. They're not sharing with others. The behavior doesn't change to be appropriate for the environment that they're in. When there's social difficulties, it may be due to impact upon the brain, or it may be due to emotions. We need to separate out whether it's due to emotions or due to the brain. If it's due to the brain, it tends to be involved with the executive reasoning area of the brain. So if it's emotional, you'd see shyness, anxiety, low self-esteem. They're awful worried about the opinions of others and more quiet. When it's executive reasoning processes, they're overwhelmed by too much stimuli going on at one time. Impulsive, irritable, rigid, can't make changes or shifts. They don't integrate things, so they don't get that they need to change based on the environment that they're in at the time. And they don't get the sequence. They don't understand that their actions can create a problem later on. So how do you separate that out? Neuropsychological evaluation or psychological evaluation or both. If you do a psychological evaluation and you have emotional findings, that would be like a fragile emotionality, maybe a fearful nature. Maybe there's a genetic anxiety or trauma, verbal abuse. There could be a genetic depression or a lack of identity and a sense of self. If you do neuropsychological findings and you find executive reasoning, you may find deficits of integration, selective attention, poor sequential analysis, that they don't understand the situation and the impact of their behavior at the time that it occurs, and they don't learn from past mistakes. Treatment really depends upon the causal factor, so evaluation becomes the first step. Treatment's based upon whether this is social issues that are related to emotional, anxiety, shyness, depression, or are the social issues related to the brain, such as executive reasoning and the lack of the ability to sense the social cues and to know how to act, and also to control the brain function to be able to act without being impulsive. Once we know the reason why, there are different options for treatment of social difficulties: individual therapy, social skills groups, or neuropsychological training if the problem is related to the brain. School accommodations. It's important to identify if there are social difficulties, if they're present, of course, and to treat them effectively as early as possible.